So essentially, they're dividing people up into two groups. So you're over 65, or you have a chronic medical condition that puts you at increased risk for severe disease from COVID. They are including pregnant women and recently pregnant women in that higher risk group. Now, the bar that these COVID boosters would need to hit is based on antibody levels. So as long as they trigger a certain level of antibodies in the person vaccinated, they would move forward with approval. But for everybody else under 65 who does not have one of these chronic medical conditions, who's healthy, not pregnant or recently pregnant, for those people, the bar would be much higher, where the randomized clinical trials would need to prove as a primary endpoint, these vaccines are reducing symptomatic, so in other words, COVID infections that cause symptoms. In addition, they would be looking at other outcomes, which are even more important, frankly, which is, are you hospitalized from COVID and do you die from COVID?
So some are finding this controversial. Why is that?
Well, think about how long it would take to do those trials. So if you update the vaccine, and then you need to do these huge clinical trials in people to show these levels of protection, by the time you would actually have the data, you would be past COVID season.
What does this mean for people who still want a COVID booster shot?
Well, that is a very good question. So some of this will depend also on whether the old booster from the previous season is still available or only an updated booster from the new season. So if the old booster is available, you might still be able to get that. But to get the new booster, it's going to require going through these clinical trials now. And frankly, from the perspective of the pharmaceutical company, to have two separate manufacturing lines, one for the old one for the new one, is really not realistic. So I think what, in essence, this could mean is for people under 65 who are healthy, not pregnant, that you lose the option of getting a booster.